Well, Congress has a lot on its plate. Joining me now for a closer look at Washington's agenda is Republican Congressman Thaddeus McCotter of Michigan. He is the chairman of the House Financial Services Committee. Also joining us is Patrick Byrne. He is the CEO of Overstock.com, and we are waiting on Congressman Himes. So, gentlemen, I apologize he's not here yet, but I'm excited to get started with you guys. Congressman McCotter, let me start with you. One of the big issues, or the top priority, clearly is health care reform. The president is going to address the joint sessions of Congress tomorrow night. Where does health care reform stand?
Well, it stands squarely in the hands of the administration of the Democratic Congress, Alexis. As you know, after Republican losses in the last two elections, they can pass anything that they want as a Democratic Party. What you're seeing is, as your report rightly pointed out, a debate within the Democratic Party, particularly over the public option. So I guess when the president says it's time to decide, it's really time for him to decide which direction he wishes to take his party, back toward the center or to remain on the left in support of the public option.
So, Congressman McCotter, apparently one of the lead negotiators of the Senate Finance Committee, Chairman Max Baucus, has suggested that they have a bipartisan plan, a $900 billion health care reform bill. It does look at the co-op option, which is something Senator Ken Conrad, one of the participants, has been pushing, and it's looking at a tax on health insurers. Have you heard much about this plan, and if so, what do you make of it?
Well, we've heard the reports that have come out, just like everyone else, but we've yet to see legislation. Obviously, as a member of the House, I have trouble chasing down the rumors about legislation in our own chamber. But the reality will be what we see the president decide to do, whether Senator Conrad's approach, Baucus's approach will work, or whether the House is insistent upon a public option. In the final analysis, it's an internal Democratic debate that has to be determined. If they wish to work with us, we stand ready to try to do that.
Patrick, let me start in a different tact, I guess, here. You are the CEO of a company, and you've been watching this healthcare battle unfold. How is it impacting you and your employees?
Oh, the healthcare battle isn't affecting us too much. We have a great healthcare plan. It's better. We have a really good healthcare plan. If the president does come through with a public option, I'm strongly suspicious that the projections are correct. A lot of corporations will say, gee, instead of giving health care that I'm giving now, I'd rather cut it and just pay an 8% fee to the government and take it. So a bunch of people will lose their doctors. Of course, it doesn't say that in the black and white of the plan. They all say, oh, we're not saying anything about taking away from your doctors, but that's the natural consequence if you have a public plan at 8. The government can open up car washes and price car washes at $1 and run all the car washes in America out of business, and that's basically what the public plan would be.
So, Patrick, I would assume that while it may not be impacting you now, your forecasters and your financial team are sitting around taking a look at how it could ultimately impact you. What do you make of this health care reform debate? You support it?
I think we need health care reform, but there's things we could do that would actually control the cost. The problem is in health care, if I go see you and you're the doctor, you provide me services, but somebody else pays, so I don't have the normal price sensitivity. So things that made people price sensitive, again, got the market. There is a market failure here, but they could do things. I support the health care debate to the extent people are saying, let's let you sell health insurance across state lines, that there be good private health savings accounts. Those would be step forward. Just having the government already spends 47% of our healthcare dollars. Doing things that just make them more and more muscular and a bigger and bigger part of the pie, I don't see any reason to believe that that's actually going to make things better run.
Congressman Himes, I want to welcome you in. Congressman Himes of Connecticut.